Doctor, you being a neonatologist, you have seen premature babies weighing around 500 grams. An ideal baby, to my knowledge, should be around 2.25 kg to 2.5, 3 kg. That's a healthy baby weight. But if at all, when we come across babies who are just weighing 500 grams, which is, exactly half a kg, why do such premature babies get born? Why do they come out that way? What do you have to say about this, doctor? What is this situation called? Is it maybe moms are not properly, nutrient enough, having nutrient food, or is there any genetical disease that which has been happening, or why is the premature baby coming out with weighing so less?
So that's a great question, actually. But if you know the answer to that question, like why there is premature babies happen, I won't have a job, which is fine, which is good, which is good. Jokes aside, we just don't know why premature babies are born, why moms sometimes go into preterm labor. There are so many reasons. Sometimes it runs in the families. When I go and talk to moms who are in preterm labor, in like 6th month or 7th month, sometimes they say, I was born at 7th month, or my sister was born at 7th month, or my mom was born in like 8th month at that time. So sometimes it runs in the families. There's nothing we could do about it. But what we can do is there are some factors which can actually start the preterm labor or cause the preterm labor. Again, those are the things we talked about, like stress, advanced age, hypertension in moms, diabetes in moms. So these are kind of things which we can control, and those have kind of like direct impact on preterm labor.
Doctor, one thing what I would like to know is like these days, many people prefer C-sections rather than having a natural delivery, assuming that C-section babies are safe enough. Maybe naturally born babies might be premature. How far is it true? Because C-section is like right
That's
time, we know when to take out the baby, and the baby is in the safe hands without having any kind of, that hardship, labor force, labor task, everything. Babies are easily delivered safely to the hands of the doctor. And many people are in an opinion that these kind of babies, there are less chances of being, a premature baby. Is it really true?
is absolutely false. There is nothing to say that C-section is safer compared to vaginal delivery or the normal delivery. In sometimes C-section compared to vaginal delivery, C-section could be safe. For example, if sometimes we see moms with like very high blood pressures and they kind of like having seizures and convulsions, those kind of things, or very high blood pressure because of the pregnancy, then those moms may not go into labor by themselves. So they try induction, maybe normally. If not, then they go for the C-section. So there are definitely reasons and indications for C-section in mom. Many families go for like muhurtams, and
100%, sir. Obviously. Right.
that's their preference really, but it's not the nature. So they can have the C-sections for that reason, but there is nothing to say that a normal pregnancy, normal baby is going to be healthier if born by C-section compared to vaginal delivery.
The natural way is the best way, is what you said previously.
Natural way is the best way, because the issue is I'm a neonatologist, right? So I look at the babies in the NICU, in the ICU, in the neonatal ICU. So what happens is when the baby is born by vaginal delivery, so baby's lungs are full of fluid inside mouth. When the baby is coming out in the normal vaginal route, the lungs kind of like compress, and then the fluid comes out. But if a baby is born by C-section, the lungs don't have that pressure to squeeze them and get the fluid out. So actually, C-sections may increase the chance of baby going to the ICU. They're staying with the mom with kind of like breathing problems because of the wet lungs and all those things. So C-section is safer route of delivery unless there is a medical indication for mom is absolutely false.